behalf of Aakaar Medical Technologies Limited, it is a pleasure and an honor to welcome you to this important scientific webinar focused on the future of facial rejuvenation and the evolving role of advanced suspension technologies. We are privileged today to be joined by an exceptional panel of global and national thought leaders, and lead a special welcome to our speaker, Dr. Indu Balani, for sharing her clinical expertise and insights. My sincere thanks are also with our moderator, Dr. Jyotirmay Bharti, distinguished panelist, Dr. James Min Kim, who has joined us from Korea. Thank you, Doctor, for joining us so late. Dr. Garima Mehrotra for contributing their perspectives and experience to what promises to be a very highly meaningful discussions. At Aakaar Technologies, the first is also the first company to be listed at NSE Emerge, led by the visionary founder and MD, Mr. Dilip Meswani, and CEO and Director, Dr. Rahul Savakhande, a name to reckon with, who believe, and both of them believe, that the future of aesthetic medicine lies at the intersection of science, a structure, and also a lot of personalization these days. Our focus has been globally to bring in India globally innovative evidence-backed technologies and solutions that respect the anatomical diversity, ethnic nuances, and the growing demand for natural predictable outcomes. We are proud to be in platforms like today's webinar reflect our commitment, not just to the products, but to education, collaboration, and responsible advancement of aesthetic practice. The discussion around TESS Scaffold and its globally patented suspension technology is a testament to how innovation can meaningfully elevate clinical outcomes when guided by sound science and expert experience. Thank you for taking the time to join us and for your continued trust in Aakaar Medical Technologies as your partner in progress. I wish you all engage in this insightful and scientific session. And now I hand it over to my colleague Lavdi to introduce the esteemed panelists and speakers.
Yeah, am I audible now?
Yes, you are.
Yeah. So good evening and greetings once again to all of you. And thank you so much, Madhumita ma'am, for the introduction. So we are truly honored by a presence of such a distinguished gathering of pioneers in the field of dermatology. So I will begin by introducing our esteemed panel. So I will start with our speaker, Dr. Indu Balani ma'am. So Dr. Indu Balani ma'am is a dermatologist who has over 2 decades of experience and in aesthetic and dermatology medicine. Ma'am is a consultant dermatologist at BLK Memorial Hospital, and she is also runs a dedicated private cosmetic dermatology practice in Delhi. Ma'am is also the author of the book Threadlift in Dermatology and serves as a certified trainer for threads, having conducted more than 100 structured workshops on injectable procedures, including botulinum toxin, fillers, and threads. Her expertise is built on extensive hands-on experience and advanced training with the leading international experts in aesthetic injectables. Ma'am is also regularly invited speaker on cosmetology procedures at major conferences and has contributed to the chapters to cosmetology textbooks as well as a publication in the International Journal of Cosmetic Dermatology. It's a pleasure having you as our speaker for the evening, ma'am. Moving on to the introduction for our moderator. So our moderator for the evening is Dr. Jyotirmay Bharti ma'am. So ma'am is a consultant dermatologist and a hair transplant surgeon. She is also the director of Square Root Hair Transplant and Skin Clinic at Gurgaon. And ma'am is also a senior consultant at Fortis Hospital, Faridabad, as well as Paras Hospital. Ma'am is also a vice president of the FADS Society, reflecting her leadership in aesthetic dermatology. Ma'am has also received multiple awards and has delivered invited presentations at major national and international meetings, including DermaCons and EADV. Ma'am has also a publication in the EJDV on threads, and she's also one of the pioneers of threads in India. Her research work includes publications on scalp threading for hair restoration, PCOD, and mesotherapy with botulinum toxin for refractory rosacea. Ma'am has also contributed a chapter to the book Melasma. With this distinguished background, it is our privilege to have Dr. Jyotirmay Bharti ma'am moderating our today's session. Now, I would like to introduce our esteemed panelists. So, Dr. James Min Kim has joined us from Korea, and he is a board certified ENT and a facial plastic surgeon from Korea. He is also a recognized authority in test lift thread lifting with extensive clinical expertise. He has led more than 500 professional and hands on training on test lift workshops worldwide, educating physicians in advanced aesthetic techniques. Now, I would like to introduce our another panelist for the day, that is Dr. Garima Mehrotra, ma'am. So, ma'am is an aesthetic dermatologist with over 15 years of experience and is recognized as one of the first female specialists in the field in Lucknow. Ma'am is also the founder and director of the Advanced Skin, Hair and Laser Center. Ma'am is also the gold medalist in dermatology, and she is also an internationally certified trainer in lasers, injectables, and thread procedures. And her training also spans the United States, Canada, Europe, and Asia. She has also an extensive experience in non surgical reconstructive procedures for facial trauma and post cancer surgery patients. She has also worked closely with plastic surgeons in procedures such as liposuction, fat grafting, silicone implants, and skin grafting. Her clinical expertise also includes burn management and dermatological emergencies. Ma'am is also passionate about mentoring young dermatologists and integrating practical aesthetic dermatology into medical education. So, thank you once again for joining us. And now we will move on to the first session for the evening. That is, will be presented by Dr. Indu Balani, ma'am. So, ma'am,
Thanks
should we
a lot.
begin with your session?
Yeah. Thanks a lot to the Aakaar team for having this very informative webinar on threads. And so I would like to discuss this special threads today, which is the TESS scaffold threads. So, as the name says, the scaffolding. So, basically, we have up till now used a lot of threads, and we have done PDO, shifted to PLCL because of the longevity. But now these threads are again PDO, but longer lasting due to this special tissue engineering scaffold system, which lies in the name itself. So it's not basically another thread, it's a system which will pull up the tissues as a whole, and as a whole it will cause a kind of rejuvenation and some ingrowth, tissue ingrowth in the surrounding tissues to tighten the pores and lift up the tissues and everything. So this is a very, very advanced thread. So we have moved on to first generation, second generation, third generation, fourth generation, but now this is the latest generation, which has, so as you can see in the diagrams, we have used cogged all the time. Then we have also tried these cone threads, but all these worked more on just the collagen stimulation, because the anchoring depends on the vectors you have used, how many ligaments you have targeted, and sometimes it is not effective enough to hold the tissues upwards for a long time. But if the same vectors we use with these threads, this, as in the diagram you can see here, there is scaffolding. So along with the barbs, there are kind of hundreds of mono threads inculcated in that same barb. So this will work on the tissue as a whole. It will have that collagen stimulation effect, plus that lifting effect, plus it will like kind of suspend and fixate the whole tissue without any cheese wiring effect. Because sometimes we've seen that if you've not used the right number of threads, there may be just some kind of uh, like the tissues look lifted from one end and not from the other end. So that kind of complications again, which we were having with the use of lesser number of cork threads, have been done away with once we start using this. So let us see how this stress works. So basically, as we know, the cogs are for lifting and anchoring the tissues. So these threads also have cogs, which will help to anchor the scaffold in place initially. But once the scaffold is anchored there, then the initial the work starts happening. So the pressure from the cogs is spread out across the entire scaffold, and you can see how the tissue not only lifts up, but there is a certain kind of evenness and a volumization effect also to the tissues. So, as we've seen the structure, now let us see how it is different from the cork threads. So, everywhere you can see, ranging from the suspension and fixation, tensile thread, holding power, perpendicular adhesion, everything is stronger in the TESS scaffold threads because of course, the structure and the tissue support which it is giving. The collagen production also increases multifold because of the scaffolding which is there, and there is tissue regeneration. So, not just a lifting, but there is tissue regeneration as a whole, leading to good volumizing effect also along with the lifting effect. So, material, as I said, the material is, of course, PCL would last in the body for long, but then because of the structure of these threads, it is having a long term effect as it is lifting the tissue as a whole and regenerating the tissue as a whole. That is why we can say very easily why we would want to use the TESS lift threads is because it is, see, it can be used like your other threads. So once somebody has learned the technique of inserting the cork threads, they can use these threads in the same way. So visibility wise, they are same as a cork thread, a thicker cork thread in a cannula, but inside, the because the structure is different, in the same manner you're inserting but getting an entirely different kind of result with an immediate natural lifting, and also the tissue scaffolding and the engineering which is happening inside. So because of all these reasons, I think it is now time to shift to better generation of threads also. And of course, if from the structure we could think of if maybe it is only for the cheeks or something, but then there are other kind of threads for the nose also, for the eyebrow also. So each region has a thread in TESS lift also, like you have used cork threads in the past. So in every area you will be giving a better tissue regeneration effect when compared to the cogs that you have been using. So it is suitable to tighten the facial contour, more defined V-shaped jawline. So that also depends on the vectors. So now when with the cork threads, we were giving the vertical vectors, they were anti-gravity. So the effect did not last that much. But now, because of the scaffolding again, which is there with the TESS lift threads, the effect even with the vertical vectors is there, and that would result in a V-shaped jawline because it gives a very nice vertical lift to the face. So jowls, cheeks, everything can be targeted, and if you have done the procedure well, and if you've used the ideal number of threads on a full face, it can be comparable to a non-surgical full face lift with a longer lasting effect also. So the anatomy is similar for the TESS lift as we have been studying for the other threads. The layer of insertion would of course be the subcutaneous only, that is the layer for all the threads. But again, we have to consider these ligaments as our anchoring points. So we have to know the position of the ligaments, the septae, the zygomatic ligament, the masseteric ligaments, the mandibular ligament, and the platysmo-auricular ligament, so that we can take the help of these ligaments to further lift up the tissues and keep them lifted in a longer for a longer period of time. So because of all this, the vectors again would be similar to the threads that you have been using also, but then there is a slight difference in the vectors because with these threads I have seen that the jowls can be targeted better, especially if we go a little bit below the jawline. So we'll be showing you the vectors also, how you can slightly use them in a different way to increase your effect and to increase the tissue repositioning of the entire face. So mainly for the jowls and all, I've seen the results increase a lot with these kind of threads. Of course, we are using all these ligaments for our anchoring. Let us first see the nose vectors, and then we will come to the vectors for the full face. So for the nose, again, the effect is better. Why? Because again, the tissue, the scaffolding lifts up the tissue in a better manner, and you get a sleeker result with the same number of threads. So you can just mark your entry point whenever you're doing nose thread. I think this is the entry point which most of us are taking for the slimming of the dorsum. So you mark that entry point in between the two alar cartilages, and you can just give some anesthesia all around on the red dots that are shown here, and mark your points, and then the thread can just simply be inserted like a cork thread from the entry point going to the root of the nose, in the center, of course. And this will give a very nice nasal dorsal augmentation, particularly through the ability to collect and gather the surrounding tissues in the midline. So I have also used these threads on the nose, and seen a difference. With lesser number of threads, you do get a better structured effect on the nasal dorsum. So for the lifting of the tip also, similarly, that we are inserting other shorter cork threads. So there are special cork threads for this test threads also for these, for the surgical tip. Here again, the entry point can be same, and you can just insert the thread like this for the nasal tip projection, so that the two medial crura can be brought together. Again, the result, because of the scaffolding, you are inserting maybe more material, and you are getting a better lift and a better support to the cartilage from below. So these I haven't used. So maybe Dr. James would be able to enlighten us more about the use of these threads, the curves for narrowing the nasal ala. But they are again something which our patients usually want, and sometimes with fillers it is a risky area, and you will not give the entire result. But with threads, it actually will improve our results if we learn this technique also. So, for the face, as I said, the suspension and the fixation can be better done if you use these vectors. So, usually you have 10 threads in a packet, and although they are packed individually, so if you use the entire 10 threads, you will get a beautiful lift and a V-shaped face to the shape to the face. So for the suspension fixation, you can start from the temples and give two threads like this. This will be passing through your ligaments, through the temple and the zygomatic ligament and the masseteric ligament. So it will give a very good lift to the jowl area. You can also lift the marionette area by starting a vector from the marionette line, another for the nasolabial folds above it, and one which will help with the jawline. So usually in the jawline, we have learned that we start below the ear and we give two threads above and below the jawline wherever required for a horizontal kind of lift. But this TESS thread specifically, we are using this vector to give a more V-shaped and a vertical lift to this area. So even the jawline, especially in the Asian faces, we've seen that a vertical vector gives a smoother and a more V-shaped look when we use this vertical vector rather than a horizontal vector, because a horizontal vector from the angle of the mandible that we usually take may actually broaden the face also. So this is usually a better vector which starts from near the tragus only, and it can cross the jawline and go down below. So this gives further shaping to the face. So we have already shown, these would help with suspension fixation. These would help with maintaining the tensile strength and the holding power. So you get a better result on the jowl area. So again, there is one more USP. We are not wasting any thread, and one thread is actually being reinserted in a U-shaped manner. So it is actually forming a loop at the point of ligament adhesion. So that is why this serves as a good anchoring point, and the whole thread is utilized, plus one thread becomes equal to actually two threads with that scaffold. So you are increasing more material, more results. So for marking the vectors, we should actually mark the target points first. So the target are usually the nasolabial, the marionette, and the jowls. So these numbered points are the target points. From there, we can go in a reverse direction upwards. So we can make these vertical vectors upwards, and wherever possible, like the last jawline vector we've shown near the ear, we can cross the jawline and go down like this to give this U-shaped. Again, the U-shaped loop is just shown so that the thread crosses this, and then the other part of the thread is reinserted and goes towards the marionette. So we are utilizing it and giving further support to this area. So if you mark the target areas correctly and then take your vectors upwards towards the point where you towards the entry point, which would be on the lateral side, obviously, because the lateral points have greater lifting capacity, and we usually try to anchor our points of entry at the lateral part of the face. So these vectors would go a long way in firming up the whole face. So uh, we don't have a video exactly, but if some of you have had a training on your aptos threads also, they are also reinserting it parallel to the threads. But here we are reinserting, but a little away. We are forming a good U here, inverted U, and this gives a further wider support to that area, and it minimizes the foreign body sensation and enhances the suspension stability by ensuring that the two strands are not positioned too closely together at the entry point. So you can uh, just have a diagram of this in front of you and try it in this way. I'm sure you'll be getting better results. So again, to specify the markings, the entry points are marked on the lateral parts, and the target points are first marked, and then you take your vectors to your entry points, and thus target the nasolabial folds, the jowl, and the sagging under the chin. And from the hairline, your vectors can start giving this a good lift. So here, once again, according to the male and female faces, you can tailor your points of it, making the vectors more vertical in kind of male faces, and more oblique and vertical in female faces. And the important point is to set a vector line from the main target points located on the chin, under the neck, under the chin, to the entry point by crossing the jawline. So this is the USP. You can cross the jawline and improve your effect by giving this U-shaped loop also, and by supporting the area under the jawline, so that you get a better vertical lift on the jawline also. So after making the markings, you can just give anesthesia at the entry point. You can just give the anesthesia, bolus of anesthesia, and then you can just infiltrate it all along the vectors also to make the procedure more comfortable. So 2% lidocaine with epinephrine can be used at the entry points, and it can be mixed with soda bicarb to decrease the burning sensation with it, and then infiltrated all along the tracks to make the procedure more comfortable. So the infiltration can be done with any 70 cannula and along the entire track. So after the infiltration, you just start inserting your threads like your other cannula threads. These are a bit thicker, so you can just screw them in also very gently, and the insertion procedure you will feel is the same as you were doing earlier, but the results are better. You can also use a V-shaped vector over here going on to the temple for a very strong fix also in a very heavy face. So if a temple lift is also required, you can fix it. You can use all these vectors plus give a reverse U-shaped vector. So one single thread, you can take it upwards and form a U-shaped loop over here also to give that extra support to the temple area and lift a heavy face in a better manner. So when other cork threads are used in this way, force is applied to only one part, causing pain when the patient chews or opens. But then these have, because they have a tissue engineering system, there is no pain also. Only the initial swelling may be a lot because you have inserted so many threads. But that also again depends. If you've done the procedure very gently, if you've given proper anesthesia to the patient, it does become very bearable. Post treatment, usually a band is preferred for overnight, wearing overnight for 3 to 4 days. So this will help in further firming and improving the results, plus decreasing the pain also. So lifting without fixation has been seen that it loses 50% of its effectiveness. So it is always better to give this band post treatment for any thread lift. Although in India, usually we're not giving this, but it is always better if you have this simple post treatment instruction along with your thread lift procedure that you've done. So a few photographs. These are, of course, Dr. Kathleen Chang's and other injectors from Korea only have given these photographs. Soon we will be having more of Indian faces also. So you can see the beautiful jawline change that has happened, and the other lift which is seen over here. So this V-shaped lift after 2 weeks, here also you can see a nice lift to the face. So brow lift, it's really a great brow lift because of the, again, the engineering system which is there, the suspension system. So it's not just a thread. You always must remember that it's a system which you are inserting to lift up the tissues as a whole, as a tissue, and not as a particular something hanging by a slim thread. Nose results also you can see are really great. So with this, I come to an end of the discussion. But of course, yes, we can further discuss with the panelists and all. Any questions also you all might be having, we can have that. So I invite Dr. Jyotirmay to please start with the discussion.
Lovely talk, Dr. Indu. You covered everything. And now I would like to ask all our panelists the questions I have prepared. So the first question is, just 1 second. Yeah. So thread lift, is it a procedure or philosophy, Dr. Indu? Let's start with you only.
So I don't know what you mean by philosophy, but yes, for me it is a philosophy because it is something which is changing patients' lives. It is a non-surgical alternative to a lot of like good shaping to the face without going under the knife.
Yeah. Anyone who wants to add anything to it? All my panelists. Dr. John, Dr. Garima.
Hi, good evening. Ma'am has beautifully explained how TESS has, kind of changed the whole approach towards using threads, and it's a system which has to be in place. So it works on a better biostimulation philosophy. It works on a better remodeling philosophy, and the designing is such that the inflammation is reduced, but the new collagen production is better. So the philosophy is to make the patient feel better, easier after the treatment with better results.
Yes. So that is what I was trying to find out. Thread is basically collagen induction. More than lifting, it's collagen which we are building. And that is what gives you long lasting result. Otherwise, the result would have vanished the minute it, denaturates, right? Now, coming to the vector planning, it's not about lifting, but it's about restoring facial ptosis back to where it belonged, right? We are not adding any volume. We are just restoring things which has led to ptosis, right? And we are repositioning those fat back to its youth stage. Long-term tissue behavior, biology, which we talk about. Like anybody can insert thread, but very few understand where not to. If you are inserting it properly, it induces more collagen, more collagenosis, and thus leading to longer lasting result. It's not only about before and after photo, it's working with tissue rejuvenation. That's why I said it's the philosophy. It's your work is in the progress. It's not that you have done and you have forgotten. It actually does tissue remodeling over the period of long time, right?
Yeah.
So the second question to Dr. John is thread lift replacing surgery? Dr. John?
Dr. James?
Yeah, Dr. James. Sorry.
Yes.
My
Okay.
bad. My
Yeah,
bad,
yes.
Doctor.
Okay, thank you.
So,
Thread lifting is not a true substitute for surgical facelift in patients with significant laxity. As in practice, it more often compete with inappropriate volumization, especially filler-based camouflage that ignores a structural descent. So clinically, the thread lifting sits between surgery and fillers as a repositioning tool that can reduce filler fatigue and restore contour without adding excessive volume.
Yeah, so of course, he's right. It cannot replace surgery, but yes, for those who don't want to go in for surgery or as a preventive approach, if we start early, then it will go on stimulating collagen, and maybe they do not require surgery at a later stage.
Yeah, I just
Perfect.
mentioned the general thread lifting. So if you use the scaffold technique, I think is a little is a much better result, a much better benefit. We can easily avoid some side effects from the conventional thread lift. So
Yes, I do agree.
when I developed these scaffold techniques, so around 25 years ago, when I primarily performed the surgical procedure, at that times, I firstly encountered the conventional thread lift. So after then, I just wanted to develop its real close effect of the surgical effect. So that's why I needed something important element like a surrounding massive scaffold to maintain the effect after the lifting. And so I had focused at the times to develop something similar effect with the surgery.
Perfect. To sum up these things, no, they should not replace surgery. Actually, surgical facelift removes and reposition tissue, whereas thread lift reposition and stimulate tissue. A facelift is a structural reset, but thread lift is a biological negotiation. In overfilled faces, thread lifts reduces dependency on excessive filler, allow debulking without dissolving everything, recreates contours rather than adding bulk. Bridges, it's a bridge between injectable and surgery. Corrective tools for distorted filler outcomes. Thread lifts are not competing with facelifts, but competing with unnecessary filler. The future of aesthetic is not about choosing between threads or surgery. It's about choosing the right intervention at right moment, as Dr. Indu suggested. Right? So, anything else anybody wants to add? Let's go ahead to our next question. The most underrated step in thread lift, doctors? May I ask, Dr. Garima?
Yes, so it's a very important question to anybody who is planning to start with the threads or who's already doing and wants to upskill. I think vector designing is the most underrated part of the treatment. People are in a rush to just find points and or maybe memorize those 2 3 points which their trainer has taught them and keep doing those. So assessing the face will differ from male to female. There will be age difference, there will be scarring, there will be some young faces would have sagged more, some old faces would have good muscle tone. So I feel assessment is underrated, is not done properly by most people, and vector designing, especially in case of tests. I would say that if you've planned your vector correctly, the lifting points correctly, the procedure is, as ma'am has stated, is not very different from what we were doing previously. But the vectors are definitely different, and the art of reinsertion, that has to be mastered. So those are underrated, or people jump to putting the threads faster, not understanding the designing of the vectors.
Yes, and it depends mostly on vectors that how your tissue will remodulate, right? How it is going to engineer all the cascade of reaction which is going to happen over a period of months, right? How your tissue is going to produce new matrix and can lead to longer lasting result. That is what, right, Dr.
Yeah.
James? Anything you want to add?
Yeah, so I also think the vector planning is critical, and facial soft tissue descent along the predictable pathways defined by retaining ligament orientation and the smash sliding plane, and the fat compartment mobility. And so effective lifting requires factors that oppose gravitational descent and ligament tethering and redistributes load across multiple fixation zones. Common mistake is following wrinkle lines instead of tissue descent vectors, using the symmetric vectors despite asymmetric aging, and concentrating force on the single fixation point. So over volumizing instead of repositioning. So regarding the scientific principle, so the lift durability improves when forces are multivectors and distributed across facial support network, and anchored in stable anatomical zone. Yeah, it is very important to consider the proper planning for the vector.
Right. So if I have to sum up, patient selection is very important. Like if patient has early jowl, mid-facial descent, soft jawline blurring, early neck laxity, those are considered very good candidates. But if patient have heavy, thick, very lax faces, advanced sagging with skin laxity, then they are poor candidate not for thread, but thread alone treatment maybe. Maybe you need to combine it with multimodality treatment like EBD devices and first to, debulk the face and create the collagen first, and then probably choose and going for the thread treatment. Now coming to the vector planning, yes, direction matters. Anchoring zone, deciding the exit points, and means wrong vectors means early relapse, dimpling, unnatural pull. So designing a vector and its straight line is very important. If your vectors are not straight, obviously the pull is not going to lift the tissue in a good manner, right? And there will always be a traction and it can lead to thread breakage and whatever. Plane does matter. If you are very superficial in the subcutaneous tissue, you are providing more lifting to the tissue. But if you are a little deep in the subcutaneous tissue, like deep subcutaneous plane, then there will be a different outcome. Like you can volumize the face in that matter. Now, coming for the post-procedure care, it is also important. You have to gently massage, mold the thread so that there is good, contact between the tissue and the threads. Sleeping position does matter. We have to guide the patient that for 7 days you have to sleep facing upright and you cannot sleep on sides. Otherwise, it can, detach the anchoring point from where we have lifted it. Facial movement should be restricted while you're talking, you're making facial expressions. You should be limited for 7 to 10 days till entire tissue gets engaged with the thread. Chewing advice and all that. Now, coming to the next question is, thread don't lift skin, they lift decision. Tell me, Dr. Hindu, what do I mean by that?
What is it? They lift
Decisions.
decisions.
Yeah. I'm making it little philosophical. We are discussing all regular things in all the conferences. So here we can, discuss little in
Yeah, so basically, it's a decision to for anti-aging. It's a decision to make your skin generate more collagen and to get back your kind of like prevent slow aging in a manner. So yes, it is a decision. It will not. It is not just a one-time thing. It's not just something which you are doing on the skin. It's a long-term anti-aging thing, which the ongoing process for the body. So it is a decision.
Yeah. Dr. Garima?
Yes, definitely. I would say it is a holistic procedure. You have to consider the patient in totality as an individual. So, you just cannot come up with just one thing as a solution for, a plethora of problems the patient is, uh, coming up with. So you might have to make a very smart choice between threads or fillers or energy-based devices or whatever. So we have everything. So it's not a one-stop solution. It has to be in cohesion with so many other things that can be offered to the patient.
James, anything you want to add?
Yeah, so I think that so the vector is always important. If you have wrong vectors, usually clinical consequences is early recurrence of sagging and or sometimes overfill, the bulky midface appearance, a distortion or of natural facial proportions. So also increase the if you use the conventional thread, to increase the risk of thread migrations or cheese wire effect. But if you use scaffold, you don't have to consider the migration.
Perfect. You all covered every point, but I'm just summing up. So yes, the decision which is getting lifted is to increase collagen type A. What will happen? Dermal matrix will reorganize. It will thicken. Fibroblast activation. What it does, it increases the collagen. So collagen will be increased. Upregulation of TGF beta and wound healing pathways. It does what? It reduces inflammation. So skin will have less inflammation, less oxidative stress. Endothelial cells decide to improve vascularity. So everybody is deciding to lead good thing happening to your skin and lifting that stays longer. They remodel tissue. They do not only suspend it. Ultrasound and imaging studies in human demonstrates increased dermal thickness, collagen-rich perithread zones, improved tissue density. So thread do not lift skin in a sustained way. They are lifted by the biological decision, which are increased collagen, increased fibroblast activation, upregulation of TGF beta, and this is what decision your skin is taking after you have done the thread lifting. So, we are having a very good interactive session, I suppose. Uh, Now coming to next question, PDO, PLLA or PCL, is it a material or marketing? Is the choice of thread material more science or more branding? Please, I would like to know this opinion from everyone here.
So there is a science behind the material also. It's not just marketing. So PDO, of course, PLLA, PLCL, it has been studied very well, and it has been seen that there are different types of collagen being stimulated, different longevity. But again, if you see the thread structure as a whole, so test fold threads are just PDO, but because of the scaffolding and because of the larger amount of the material that has been put in and the specific way in which it has been designed, it is of course a better material. Again, the PDO has
That is
restructured.
why it is leading to longevity of the thread,
Yes,
right? Earlier, we
yes,
used to say thread PDO will last only 6 months, but why not test lift?
yes,
Because
yes.
this is science. This is not material. This is not branding, right?
Yeah.
The science behind it, that scaffold which has been provided, the tissue are growing through it and getting attached to your skin. So imagine everything, the tissue which is in making, everything is supporting the tissue, right? So obviously you are getting double or triple the strength which you can get alone by this thing. Dr. James, Dr. Garima.
Yeah, so I always dislike this. When I encountered thread lift so about 25 years ago. So when I trained in the United States around 25 years ago. So at that time, so all the thread was the polypropylene. It's
Yeah.
permanent.
Yeah, the cone one,
but
silhouette.
yeah,
Silhouette.
all
Yeah.
the material was permanent one. But effect is just several months. That's it. So the longevity is not never related to the material itself. If you use the cog thread, the cog function is never maintained. So material is not is meaningless. But if you use the scaffold, we need to consider the materials, which is better. So, for example, PDO is characteristic is usually faster degradation and a moderate collagen stimulation and a softer and more flexible mechanical behavior. So clinically predictable absorptions and lower long-term foreign body persistence and useful for subtle repositioning of dynamic facial areas. If you use the PLLA scaffold, we need to only focus on the scaffold regarding the material. So if you use the PLLA scaffold, the characteristic is intermediate degradation, as you know, the stronger collagen stimulation response, the moderate mechanical rigidity, clinically enhanced fibroblast activation and collagen remodeling, the often used where structural reinforcement is desired. So it's like a sculpture. It's the different shape of the material. But we need to focus on the real structure of the scaffold. A scaffold has proper pore size and the proper pore linings. So we need to focus on the real biological response. So the key point in response is M2 healing stage transition. So more hydrophobic materials usually induce is like a chronic, subchronic inflammatory response. So M1 dominant response, especially initial stage. And then we also need to consider the real proper longevity as a observable scaffold. If the duration is over 3 years, I think that is not observable one. So at that time, so non-observable polypropylene would be better than the PCR or other material, I think. We can use the PDO scaffold if the effect maintained over 2 years. At the times, we don't have to use the more hydrophobic is less biocompatible material like PLA PCR. It's my opinion. Yeah.
In your opinion, Dr. Indu, Dr. Garima, what do you feel you have, Dr. Indu, you have done every threads, right? So what is your personal experience? What do you find while doing PLLA or PCL we are doing recently too much in India? And we have been doing for edges like PDO.
I think PDO. So I think that the PDO, am I audible? No.
Yeah.
Hello. Yeah. So the PDO has always given a better instant lift. So initially, when we used to do the PDO threads, the lift was actually visible on the table
Amazing.
also. Yeah,
Amazing.
but with the PLCL and all, it takes time to develop, maybe because the material is not that kind of
Tough.
immediate kind
Stick.
tough. Yeah, yeah. It does regenerate more collagen over a period of time, maybe the softness of the skin is better, but then PDO has always been the material for thread lift, and it is safe also. It has been safe for ages.
Second you. I second you. Dr. Garima?
Yes, I totally agree. I think everything has been covered. And the three-dimensional structure with the scaffolding threads I've brought in has also, just enhanced the use of PDO. And I think globally, also, if you see the trend, PDO is trending more than the other threads.
Yeah, so in my recent Instagram post, I combine both of them. Why are we using PCL, first of all, right? Because they are promising longevity. They are promising the effect will last 2 years, though it's not true because I have been doing for many years and I've seen it weans off, but not as early as PDO. So why we are choosing PCL is because of the duration, right? Why we are doing PDO is for the lift. It gives instant lift, like even fillers sometimes cannot give it. You're just repositioning your own dropped facial fat pad into its original place. It's amazing. The result is like, wow. But we are shifting, we were shifting. Now, due to test lift, since it has come for the promise of staying longer, I've been doing it for more than 10 months now, 8 or 10 months, I don't know. I don't remember exactly. So let's see how much promises it's going to fulfill. But right now, what I'm adding, I understand it's PDO. I don't know how much longer it's going to do, but if my patients are paying well to me, what I'm doing test lift first, 2 or 3 packets, and then I'm doing PCL. So thread lift, I'm doing test lift is because of the lift I achieve, the wow factor. The patient gets very happy. And I'm doing PCL in situ so that the result should last longer and there should be more collagenoses. So rather than adding more test lift and more PCL, what I'm doing half and half. So I'm getting the wow result and I'm getting probably the longer lasting result. Let's see how my patients are returning. So yes, if test lift is going to promise what it is suggesting, I think days with PCL are over because we all feel that PCL is not lifting as much we see with PDO. The wow effect is not there. So if that wow effect is not there, patients are not gonna come, right? For collagen modulation, that you can do with any energy-based devices. You can do it with any, injectables, other injectables like boosters or this thing. So
Yeah. So when I open the presentations, these days so many questions regarding the materials, PLLA or PCL. So these days I recommend like this. If you want PLLA, PCL thread or scaffold, I think that it is better to use to combine with the collagen stimulator. For example, the PDO scaffold and PDO thread plus the Sculptra like this.
yeah, so you're mixing PLLA and
because the PLLA, PCL, the thread have no functions after several months. Just still remained the material is like can be the hues skin stimulators, collagen stimulator, but the structure is worse than collagen stimulator. The PLA fillers, PCL fillers. So these days, because those kind of PLA PCL filler is effectively spreading subcutaneously, it's more effective. Yeah. So these days I answered like this.
Yeah, that is also a good idea. But Dr. James, we had no Sculptra available in India. It just got launched. I don't think it's even 1 month they launched it, right? PLLA has come in Indian market. So we had no option. But yes, definitely in future, we are going to try those more. whatever you have suggested, and that's really very nice idea. What I did, I just shared, and I would like others also to share their experience that Dr. Indu very well said that PDO has given instant lift. So test lift has really emerged as a very promising, factor because it's going to last longer, the result, and obviously the lift is there, right? I don't think I need to sum up this. We have discussed good this thing. So my next question to you is age myth in thread lift? The age myth in thread lift.
Actually, I
Dr.
think we've
Garima? Yeah.
already,
Yeah, Dr. Indu, go ahead.
I think we've already discussed it partly because it should be done at an earlier age, and then
Yeah.
if there is at a later age, sometimes surgical interventions may also be needed. So
Dr. Garima,
This
anything?
is, I think that the chronological age is often overemphasized in thread lift decision makings. In modern aesthetic medicine, so candidacy is determined far more operated by tissue quality, the individual tissue textures quality, the biomedical support structures, and so actually it shows the individual difference. And when you use the scaffold, in my opinions, in my experience, I can use over 60, over 70. At the times, we need more scaffold. So this is a real load sharing, load distribution effect, and the multiple the fixation effect. So we can properly use for the aging. So over or 60 or 65. But if the doctor want to use the conventional thread, I strongly recommend before middle 50, usually.
I have used in above 80 also, one doctor, she's a gynecologist, she came and she insisted I should do, thread lift for her. And you won't believe her skin was literally sagging. Like she was a good candidate for collagen induction, which she was insisting because she was a mother of my friend. I did it, and you won't believe her skin improved multifold. Obviously, the sagging was not completely gone. She needs multiple, session about that or anything else in combination. But her lift was great, and the collagen it made was literally shown on her skin. The crinkles were gone, and skin developed. She was having a past skin, very thick, like elastotic skin, like how much you have, how you get after excessive sun exposure. So improve that also. So yeah, maybe people say don't do it in very lax skin, but I saw very good result. Dr. Garima, would you like to add any point which we missed?
For in my experience also, like the earlier we start the better, but as you said, I've also tried doing in a patient. He was from an Asian country, and he was 85, around 85, and he had severe laxity in the neck. So there I did not get great result, but yes, the face part was responded very well. And what I felt was in one of my patients, the skin thinning was too much. So and she was around 45. So she experienced a lot of discomfort. So I feel if the fat part is less, then those patients can be excluded out. Otherwise, age bracket can be very wide.
Yes. So, to sum up, chronological age, as doctor suggested, it just suggests how long someone has lived. It does not tell us how elastic the skin is, about dermal thickness, about fat compartment behavior, like how Dr. Garima just explained, rate of collagen loss, and ligament integrity. Indexed dermatological literature has shown that skin aging is highly variable and influenced mainly by genetics, sun exposure, hormone, lifestyle, and not age alone, as we all know as a dermatologist and plastic surgeons, right? So, what actually matters more than age is tissue elasticity. That threads require recoil and grip. So, for that, you have to have tissue elasticity. Quality of dermis, because biostimulation works only if fibroblasts can respond. Pattern of descent. Vector loss matters more than wrinkle count. Vector loss means ptosis of the skin. So the two common age errors are too long for threads. Error one. Many young patients already have early descent wrinkles. So thread here acts as a preventive repositioning so that they would not require many, procedures later on. And error two is too old for threads. Many older patients have good skin biology. Threads still can reposition and stimulate and can delay surgery, like how I explained my patient and how Dr. Garima explained that it does give result. Neck, Dr. Garima, by the way, is most difficult part to treat. Until unless you are combining a multimodality treatment, you are not going to get result, even in younger patients. That's why we say don't treat just the face, treat neck first because that ages faster and treatment of neck is very difficult. Aging is very difficult to remove from your neck. Right, Dr. Indu and Dr. James?
Yeah.
Yeah. So coming to the next question, overcorrection versus undercorrection, clinical dilemma. Who is for overcorrection and who is for undercorrection?
It should
In
be
most
either, I think.
modern thread lifting strategies, controlled or slight mild overcorrection is generally preferred, provided it remains within physiological and aesthetic limits. So this is because all the mechanical settling, the tissue relaxation, remodeling typically reduce the initial lifting effect over time. However, excessive overcorrection risks unnatural contour distortions, the patient discomfort, and the increased complication rate. And the goal is therefore mechanically planned, the biomechanically planned and temporary overcorrection, not aggressive over-tightening. But I think that a little different concept between the conventional thread and then the scaffold technique. Scaffold-based one is, I think that if you do the overcorrections, but effectively, fastly disappear any overcorrection corrective side effect. So if you use the scaffold, I think that you don't have to worry about that.
Yeah, it just lives fine.
Yeah, always fun.
Dr. Indu?
Yeah, I think initially we do in our cog threads, we do try to pull them up just a little bit more so that it looks a bit overcorrected initially, but then it settles down.
Settles down.
Yeah, so but then with test lift, I think because the scaffolding is there and the tissue is already, we should actually do what is required and not under or overcorrect.
Dr. Garima, anything to add?
No, I think it's, I would also say that we can go by the parameters. Undercorrecting is not needed with tests. We can safely do the required number of threads.
Yes. So let's sum this up. Overcorrection is what? It's excessive immediate lift that gives a very good lifting effect and the patient gets very satisfied. So it's a high tension on threads, but distortion at rest or movement, whenever patient is talking and making movements, they feel little distortion, right? So why it happens? Why we do it? Even I do it because fear of early relapse. We have this in mind that if you are not pulling it enough, there will be early relapse of the sagging, attempting to match surgical outcomes, overestimating thread holding capacity, ignoring tissue compliance. Consequences, unnatural facial expression, pain, puckering, dimpling, thread breakage, patient dissatisfaction despite the lift. So overcorrection treats gravity as an enemy instead of a constant, right? What is undercorrection then? It's minimal visible immediate change. Conservative tensioning, subtle repositioning. Why it happens? It happens because of fear of complication. Generally, newcomers who have just started doing it, they generally don't put too much of tension and over the thread, and they conservative tensioning. So consequences, patient perceives no result, so early disappointment. But here is the nonsense. Why undercorrection is often safer than overcorrection. Threads stimulate collagen over weeks, right? Early mechanical lifts always relaxes. Biological remodeling follows tissue tolerance. So a powerful clinical line is thread lift should look modest on the day 1 and better at week 6. Overcorrection ignores biology, undercorrection respects it. What it tries to say is tissue remodeling will take over and patient anyways are going to get and achieve the lift. So what is the missing middle point? It's biological correction, as Dr. James and Dr. Hindu and Garima has explained that biological correction automatically happens with test lift. When you are doing it, you cannot overcorrect it because of the property of the thread and the way thread is made, and you cannot do undercorrection as well. So biological correction is what? Enough tension to engage the tissue. So test lift does the fine. Because I feel with other threads, tissue engagement is not that great, and that's why you don't achieve that tension and lift initially. Not enough to distort movement. Lift that allows immediate expression, natural settling, progressive improvement. So if the face cannot move freely on the table, the correction is wrong. So how to decide clinically? Ask yourself, does the tissue recoil naturally after release? Is there symmetry in motion, not at rest? Does the skin look calm, not stressed? If yes, you are in safe zone. If no, you are drifting towards overcorrection. Now the next question comes, complication we don't talk about enough. Dr. Hindu. We talk about infection, we talk about thread migration, we talk about everything. What is that which we don't, discuss mainly?
So I think no, dimpling and everything is of course discussed, but the pain factor which is there sometimes when somebody starts the procedure, some doctors also, and the technique has not that evolved, they may sometimes not maintain the layer throughout and give a lot of pain to the patient, due to which many of the patients are scared to do the procedure. So we do mention pain and we say 5 days, give them painkiller and all, but then the pain duration and the swelling and all that comes up depends on how the procedure is done. So that is why the technique is very, very important.
Yes.
Learning the technique.
Yeah. Dr. James?
Yeah, so actually, regarding the scaffold-based techniques, so we have used, especially in Japan and Korea. So actually, so many patients, so performed, so many doctors performed over 10 years, but there was no serious side effects, no case, no complaint from the doctors. But actually, the initial stages, so always technically related to side effect. Some doctors, if the doctors have experienced the conventional thread, at the times, I think that we don't have to worry about the side effect. So I think that if you get used to it, I think that it is simpler than conventional thread. And the side effect, the mild, sometimes is the only the complaint is sometimes from the shallow depths of entry site. Because the scaffold, we usually reinsert So in the entry point, if you have if you don't make enough space for the entry point space, at the times initial stage a little palpable sometimes. For the brow lift, sometimes a little bump, but it those kind of bump like a side effect, the 100% prevented during the procedure. But if you skip it during the procedure, the bump is like this. Don't try to remove. Yeah. First is just wait. The second is sometimes you can the HA filler surrounding. That's it. So at the times the patient easily can wait.
Because
But the common side effect is a little palpable, sometimes a little visible. A bump like this. I have no experience to serious side effect.
so far I've been also lucky. I have not faced side effects other than pain. Sometimes patient complains about the pain for months together, and sometimes it's difficult to judge why the pain is there. Your technique was good, no nodules are palpable, nothing. But yeah, I think sometimes, maybe because of greater tension or something, or maybe irritation. Sometimes, patient wash their faces and they kind of, engagement of cogs become little mobile, and they keep on engaging and disengaging the skin. So that is also a possible, cause of long lasting pain, but it subsides gradually.
Yeah. So
Anything else, Dr. Garima, you would like to add?
Yes, I agree. Like most of the complications are like I've seen is patients who are they try to open them out too much or try to see the entry points or touch the face too much after the procedure. They might land up in some complication like infection and all. The other complications would be some bruising or pain, some restriction while chewing. Other than that, nothing much.
yeah, so these
Edward,
days I strongly recommend that during the procedure, always over the compression. It's like this. You
Yes.
can effectively prevent those kind of bruise or bleeding. So compression is very enough to prevent those kind of bruises like this. But during the procedure, we need to frequent
how
over
many
the
days you
compression.
suggest, doctor? Compression? 7
Compression.
days are enough, yeah?
Yeah, so during the procedure, we need to avoid compression is very important. After the procedure, we need the bandage.
Yeah,
It's
that is what the
very
bandage compression. For how many
yeah,
days you
bandage.
suggest generally?
Yeah, so bandage. So actually, the bandage is very important. I usually tell the patients if you don't use the bandage, the 50% effect goes away. It's like this. Yeah. So this is very important for the fixation.
Yes.
The tissue ingrowth and fixation is getting increased after around 4 or 5 days later. The 80% of the strength is completed at least 2 weeks later. The first 5 days is very important before the proper adhesion happen. Yeah, so this fixation is always important. But sometimes some doctors or patient ask me, so the thread lift doesn't need the band. But my answer, if you perform the thread lift, you have to use the bandage over 2 weeks. It's like this. Yeah. So it's the fixation bandage is always important. If you perform the brow lift, at least a small band like this, at least for 3 days before the proper fixation happen.
Anyone have seen fibrosis, clinical fibrosis due to thread lift? multiple times?
As such, no. I've inserted like threads multiple times over a period of years, reinserted threads in the same patient again and again. But as such, no.
Even I have done it for 10 years. I have been injecting, same patient. She's also not pro for filler. I've never seen any scarring, fibrosis, and difficulty in inserting thread further. But it has been mentioned in many. So today I was going through some journals and I read that clinical fibrosis is very common. I don't know who are those patients who are developing this, but they are saying repeated thread, insertion can lead to this. But I have never encountered such thing. No? Good
Yeah.
for us. Good for us.
Not for me. Not for me.
Okay. So can we move ahead to next question? So tell me the sequence. Threads first, filler first, or energy-based devices first? Order matters?
Energy-based devices should obviously be done first, so that we're not giving heat in the same area where we've used our uh, injectables. And for me, threads are always before fillers, because that sometimes decreases the requirement also. And then once we've repositioned the fat pads, then we know better where to put the filler.
But why? Dr. Karim, explain why we are doing this in this
So
sequence.
if we adhere to the sequence, yes, with energy-based devices, we are not actually putting anything into the body. We are just giving energy, and there is modulation of the tissue. And once we are putting the threads, we are lifting up the fat pads, repositioning the skin, giving it more tensile strength, and uh, obviously the structure of the face will change. So the position of the filler will also change. The amount of requirement of the filler will also change. So I think this sequence is perfect.
But why? Dr. James, can you explain the sequence which Dr. Indu Balani just mentioned?
Yeah, the sequences I always strictly like this, answer like this.
We are all doing
The
like
first,
this,
yeah,
but
the
now the
first, yeah,
students need to know
yeah.
who are just into the
Lifting,
business.
lifting should be the first, and then second is the filler material. After then, several weeks later, and then energy-based device. But as Dr. Bhatti mentions, sometimes if the patient have very the special skin conditions, need to increase the collagen. So at that times you can perform the collagen or EBD. The, can be forced at the times, but normally, I recommend lifting procedure should be the first, because the aging process is from the ligament laxity, and then fat compatible to descent and the smash relaxation, and fibroreceptor support weakening. So these structure distortions should be corrected first. After then, we can effectively use the fillers. Sometimes we can effectively reduce the amount of the fillers, and then we can apply the filler more precisely. So the lifting procedure, and then we can precisely, effectively consider the amount of the filler or the location for the fillers. Yeah, this is my opinions.
So basically, you both are correct, as Indu Balani said, that first energy-based, then threads, and then filler. But you said first threads, filler, and then energy-based devices, right? Both have places in your this thing, but we all agree not filler before threads, right? Because thread leads to structural liftment, right? But it can cause little bit of asymmetry or little bit of hollowing, like under eye hollowing, not corrected fully by threads, right? So that will lead to less consumption of filler. So wherever you feel deficiency, it is a precise liftment, the filler injection, right? So when you are doing filler, it's a precise upliftment of the skin. It's lifting very precisely. So when you are doing thread lift and you feel some area require targeted volumization or lifting, that is where your filler comes into play. That you are putting the filler and you are just making the face symmetrical and lifted, bilateral symmetrical and nice looking, right? Now, why EBD before and why EBD afterwards? So EBD you can do afterwards, but after 1 month of doing any kind of injectables, right, panelist? Because if you are doing before 1 month, it will melt away the filler you have done, or maybe it will denaturate the thread you have placed before it has even started its action, right? So when you're doing injectable first, wait for the EBDs, wait for at least a month or two, and then you can do your EBDs. If patient is not ready and they are saying, no, I need instant result, I have some party, some function to attend to, I have some important business to attend to, of course, you can do thread lift and filler, and then you can start EBDs later on. But for in my opinion, like Dr. Indu Balani, if a patient has come and they have volume over the face, obviously you would like to debulk the face first, right? You won't want face to be looking bulky after lifting. So you'll for debulking you can do RF laser, you can do HIFU, and that is how you debulk, and then you lift and like you reposition, and then you lift with filler. But if or you can do if patient is not very bulky, but still if you want to go for EBD devices, in what cases you will choose EBD first? Because the skin is very saggy. It needs collagen induction. It is highly passed. It has no life. And you really need to induce some collagen modulation and biological process to start. So obviously you will do few sessions of RF or micro needling to regenerate some collagen so that when you are lifting, it lifts well and it not droops down, like a sliding thing over the structure. So obviously you should prefer first EBDs and then filler and thread lift. But sir also suggested, Dr. James, that you can do EBDs later in those patients who has some emergency and important functions to attend to. So do these procedure, give them a lift, and then you keep doing collagen modulation or debulking or whatsoever. Right, Dr. James? Any other reason for which you choose EBDs later on than which I suggested?
So it is so can you
Should I ask you the question again?
yeah.
So whatever I suggested that in this cases you can do later, do you feel any other, reason for choosing it later on, doing it later on?
Yeah, for the
Like
EBD.
after injectables, you said you can do EBDs. In what condition? Okay. So I think we are done with the questions tonight. And now is the time for the delegates to ask questions. Do we have any questions so far? Labdhi?
No, ma'am. As of now, we don't have any questions in the chat box.
Okay.
Yeah.
So what do you suggest?
I
Can
think
we ask
we should.
delegates to post some questions? If you have any questions from any of our esteemed faculty, you can post right there in the chat box, and we are here to, answer any of your questions. I think our lectures were too good and discussions were great. Students don't have any questions. So let's call it a day.
Yeah.
Yeah.
Yeah. So moving ahead, I would like to thank you all our
Sorry.
speakers, our panel, and all our attendees for such rich insights, and all
Sorry.
attendees to
Is the
yeah.
connection is is not that good.
You
Sorry.
can't hear us, I think.
Okay, I can hear now.
Am I audible, Dr. James?
You're audible. I don't know.
Yeah,
whether-
yeah, audible.
Yeah.
Yeah,
Yeah.
thank you.
So thank you to all our speaker and panel members for such rich insights, and to all our attendees for joining us today. So now I would like to request Madhumita ma'am, she is the Vice President at Aakaar Medical Technologies Limited, to deliver the vote of thanks and finally conclude today's proceedings. Over to you, ma'am.
Thank you, Lavdi.
Thank you.
As we conclude today's, I think the entire discussion was very insightful. It is my honor to propose the vote of thanks on behalf of Aakaar Medical Technologies. We extend our heartfelt gratitude to our distinguished speaker, Dr. Indu Balani, Dr. Garima Mehrotra, Dr. Jyotirmay Bharti, and Dr. Mingim for sharing their deep scientific knowledge. I think the entire stage was set on fire with Dr. Indu Balani making this entire scaffold thing so easy to comprehend, and then a very energetic moderation by Dr. Jyotirmay Bharti, and the insights that Dr. Minkim and Dr. Garima provided us. Thank you for sharing your deep scientific knowledge and clinical expertise and your global perspective. I think the session beautifully highlighted also the innovation, precision, and the transformative potential of TESS in modern facial rejuvenation. We truly appreciate your time, commitment, and invaluable contributions to today's webinar. I'd also sincerely thank all the esteemed doctors and delegates who joined us today. Your time is valuable, and all of you joining today makes this webinar very, very meaningful. At Aakaar Technologies, we remain committed to bringing globally advanced evidence-based aesthetic solution to the Indian medical fraternity while fostering continuous learning and meaningful scientific dialogues. Today's session is a reflection that we are really, really committed to the modern science in aesthetic dermatology. Also, a special note of appreciation to our organizing and the technical team, and to all my dear field personnel out there. Their dedication and seamless execution also ensured a very smooth and successful webinar. Once again, thank you to our speakers, delegates, partners, and whoever has been a part of this journey with Aakaar Medical Technologies. We look forward to your continuous association and to welcoming you at our future scientific programs. Thank you so much, and everybody have a great weekend.
Thank you.
Thank
you,
you.
everyone.
Thank you so much.
Good
Thank
night.
you.
Thank you so much,
Thank you.
everyone. Yeah, thank you so much.
Thank you.
Yeah, it was
Thank you so
great
much.
interacting with you all. Thank you.
Thank you so much.
Thank you so much.
Doctor. Thank you so much.
Fantastic. Thank you.